Hello everybody and welcome back to this vlog, and today's vlog is going to be about how we walk. So it's going to follow on a little bit from our heel pain and plantar fasciitis that I covered a couple of weeks ago, as obviously walking is quite imperative with heel pain. So let me just share my screen. Now, when was the last time that you thought about how you actually walked? Probably not many of you, and probably thinking, well, how do you teach me to walk when I walk already? Well, do we walk as well as we could do? Maybe. So let's just think about what changes our gait. So by what we mean as gait is how we walk. So that's the term that we use. So gait is our walk. So any of you that had any, obviously, lower limb pain, foot pain, knee pain, hip pain, even lower back pain, limb pain, will know that you probably start to walk a bit differently. Poor footwear, obviously, when you get a sore toe or a bunion or a corn or a verruca that's painful, then you may find that you start to walk a bit differently. But they're sort of short-term measures, aren't they? When you've hurt something that's, gets better within a few days, you sort of think, well, I don't walk any differently after that, and you get back to normal. But when you start having things like degenerative joints, bad knees, bad hips, then our gait changes quite significantly. And then when you have a hip or knee replacement, you then have to relearn how to walk. And lots of people we see are then walking very differently. And especially if, like with a knee, you get a very bent knee, and it can make you, and the hip as well, it can make you feel like you've got a short leg, and you may have been walking with like a bowed leg, short leg for many years, because it's obviously a build-up before you have a replacement joint. And then the surgeon then straightens you up nicely, and it's like, oh, I've got to learn to walk more evenly again. And some people's bodies naturally do it. Other people need some more assistance, and especially if they've got quite poor joints in their lower back, that transition, the lower back doesn't like it, and they start to get sort of low back pain, which is quite a common thing, especially after hip replacement surgery. So also, if you've got spinal curves, you might have a naturally short leg, a short bone, a short femur, can then keep you off, and then you start to wobble and rock around a bit rather than a nice cross force movement. So we talked about operations. Injuries and injuries can also change how your brain thinks about where your body is in space, and so can actually block off certain muscle groups, and you then don't use those muscle groups as efficiently, and therefore when we walk, you're not using like your glutes as well as you could be, and you end up sort of lopsided, and that gives you more low back pain or knee pain or hip pain, depending on where you're feeling it. Then we've got obviously more neurological issues. We're not going into sort of people with pathological things or people with disabilities or that sort of thing. It's not really what we're here to talk about today. That's another vlog. And also your mood, excuse the bird, always has to chat when I'm on chatting. Also our mood can change how we walk really significantly. So, when you're depressed, people head drops, the head drops forward, or you get the swagger if you're really sort of feeling really happy. That can change your walk too, a bit of a spring in your step, as it were. So there's lots of things that can change our walk, and this is what we think about when somebody comes to see us, and we're always on the lookout as you walk into our treatment rooms. We have a little quick peek at what you're up to when you're walking in, because it gives us an idea about what's going on. And sometimes quite frequently. In fact, you can sort of see quite big changes in people from treatment to treatment. And of course, if I have not met the person before, it gives them, I guess, a great idea about what's going on with them. So is this you? Have you joined the zombie nation? So there we go. Now, what do we notice about this meme? I think it's a meme. No, it's a GIF. My son keeps telling me off because I call things a meme when actually they're GIFs. Excuse the advert for the film as well. But as you can see here, they're not using their arms. And so it just makes your gait completely different when we don't use our arms. So a lot of people today walk along the road looking at their phone, holding a bag, and then they don't swing their arms around. So this changes how our body moves. And so I'm going to just go on to this next slide. Now, I've got to just give you a warning. For those of you who don't like too much flesh, then you need to stop this vlog now, because the next slide has semi-clad ladies in it, as you can see. So why have these are all GIFs. And I just wanted to show you what I mean about walking. So this is obviously on a repeat, and you can see with this chap, again, he's not really using his arms, is he? His arms are still, and he's rotating. You can see how he's sort of rotating his upper back, and he looks like on his left leg that he leans on that a little bit more and slightly swings the right leg through. So that's him. So stop him from walking. Now, if you're out with your dog, is this you? So look, again, no arms. Well, I'll explain the significance of arms a bit later. Holding onto a lead. You know, you think, well, what's wrong with that? Well, the thing is, there's nothing see, forces that are created in walking that come up our leg need to be counterbalanced by the upper body. And so his whole upper back is absolutely, spine, really, the whole spine is really still. There's obviously a little bit of movement around the pelvis, but there's no transference of forces. So I'm just looking at his, and again, he goes off to the right a little bit more, but that's slightly harder to see. So when you're walking your dog, you've got to make sure that that you use your arms. So swing your arms around a little bit more, but we'll show you that at the end. Now, let's stop this one. So here are catwalk models. Now, this lady here actually walks quite well, even in those mega heels. But it's this lady I want you to look at. So I'm going to stop it and start it a bit so that you can have a little look. So here we go. So we just move her. So there you go. Watch her walk down there. So I'm going to start it again. Let's just click off it. So this lady, she's sort of up. You can see she's up with her hip on her left side. And if you look at her arms, you can see the other one. She sort of doesn't swing them. Sorry, get put off by this lady at the front. And so when we look at also the buttock crease there, you can see that she's slightly less pronounced. Obviously, that bit she is because it's frozen, but this buttock doesn't switch on as much. And that's because she's got this slant in her pelvis and she's not switching on that glute on that side. She needs a bit of osteopathy. So there, can you see that? And her buttock creases, she's slightly higher on that side. And also her gastrocnemius, that muscle there on that left side, is more pronounced than the other side. So this is all sort of things that we look at when you come and see us as patients. And it just gives us an idea about how you're using your body. Now, the next slide, you might want to look away because it's me. So this is me. Actually, before I start playing it, I have I have pronation on my right foot more than I have it on my left as well. So that means I have a dropped arch more on that side. Let me just try and get rid of the, and as you can see, when I stand, you know, I look at my clothes, I am down on my right hip, slightly down on my bottom. So let's just see how so I'm this one, I'm going to walk without my arms. So let's just, and actually the day I filmed this, I had a really bad knee. So let's see if you can see how I walk. Not so bad. So now when I turn round and I walk towards you, you can see that I'm using this leg, sort of lifting it a lot more than the other one. And you probably can't see me, but I scuffed my foot on the way back. And my bottom isn't really doing much. The muscles aren't working as much, because when we walk back, we should be using our bottom. So I had a painful left knee. I have to think about my lefts and rights. So here we go again. So I'm not using my bottom muscles. My back isn't moving. I'm not really using my arms. They're moving a bit, but I'm sort of twisting. See how I rotate my leg through that side. So let's have a look when I then use my arms. So as you can see, my bottom is actually really different. I'm starting to squeeze the muscle as I lean back, and I have actually more even, look at that hip, the hip here, it's not doing that funny rotation movement. And that is just from using your arms. And actually it's not me, I'm not that great a model, but some of my patients who have warm bits would be probably quite a better selection. But as you can see there, I'm not leaning so much and not swinging my leg around and engaging my bottom. So do you walk properly? So when you go for your walks, I want you to feel like you're standing tall. I want you to engage your tummy muscles, just draw your belly button in a little bit, and then just draw up your pelvic floor a wee bit. You don't have to squeeze for dear life. It's only sort of getting your mind into these areas. I want you to let your shoulder blades relax down your back, lift your chest bone. So actually, if you lift your chest bone, your shoulder blade should naturally fall back a little bit. So we don't want, so, you know, that is how lots of people stand. They're rounded, their shoulders come forwards. Just think, lift the chest. Then what you do is think about heel striking. So some people don't actually put their heels down first, and you will use the outer side of your shoe to heel strike with, because lots of people come in and go, oh, look at my heel strike, look at my heel, it's like really rubbed off on the outside. And yes, that's right, that's how it should be. So heel strike on the outer part of your foot, and then you toe off with your big toe. So those people who have sore big toes end up then toeing off using their second or third toe, and then they get a hard bit of skin under that head of that joint, or even they start using their fifth toe, and then you see wet and hard skin again on that area of their fifth toe. So you know you're not walking very well if you're getting hard skin away from your big toe. Okay. Oh, sorry. So so that's what I want to mention today. Also, just think about your footwear. If you do a lot of walking, which a lot of people have taken up more walking or even running, then you've got to think about your footwear and make sure that you have really supported air cushioned soles in your shoes. And you change them regularly, because if you're doing, say you're doing 5K a day, and you do that for 5 days a week, you're doing 25 kilometers a week, that's, you know, you really want to think 6 months down the line, you need a new pair of trainers, okay? Because they will be wearing out, and then that impact will be coming through your joints and your heel from our plantar fasciitis. So no more walking in wellies, no more running in wellies, as certain people that I know do. And think about your poor feet. So next time, there's 2 blogs of this, or vlogs. The second part, I will be going through how you walk properly. So we'll summarize it with a little video, and then you can have a go, because some of my patients know this, I've taught them already, but for those of you who don't, the next video will help you walk properly so you don't walk along like a zombie. So I hope that has been of some use, and I will see you again next week. Have a good week. Take care. Bye-bye.